Yep, go ahead. Thank you. I appreciate it. Thanks for your patience, everyone.
Oh, really?
Yeah, this should be a lot of fun.
That should be interesting, yeah.
And so, this is a reminder, I'm Dr. Ross Reichert, I'm the medical examiner for Cherokee County. I'm the chief medical examiner. Go to the next slide. Thank you. Okay, so we'll go on to the next slide, and so it'll show you the different counties that we cover in southeastern Minnesota. So the dark blue counties are the ones that we provide full medical examiner services for, and the light blue ones are the ones that we do consult autopsies for. So we're have a pretty good idea of what's going on in this region of Minnesota, which is nice to be able to compare county by county, and we'll see some of that data here today. So if we go to the next slide, this is a list of our staff. So currently we have 4 medical examiners, so we've really grown. We have 4 forensic pathologists. Monica Kendall, who's here today, is our death investigator supervisor. We have a number of field investigators here in Goodhue County, and I can't emphasize the importance of those people. They're the ones that are here 24/7, 365, responding to phone calls and scenes and so forth. And so they're the ones that really keep things going. And so I can't say how much we appreciate their work and what they do for us. They're really the ones that are sort of the driver of things to keep things stabilized. Then we have a number of other investigators back in our central office in Rochester that also support them. And then the final line is just a series of administrative departments that support us to put together presentations such as this and to help with filing of our death certificates and so forth. So the next slide is just an overview. There were 439 deaths in the county. 411 were reported to the medical examiner's office. We did complete autopsies on 48. 7 were with external examinations, so we examined the body but did not do an autopsy, and 1 was a limited examination. And then we certified deaths without doing a postmortem examination in 41 of the cases. And so these scenarios are kind of increasing as we have really aging populations and individuals that are on hospice and long-term facilities. They may have, as an example, a known fall, but they might not get medically evaluated, as an example, because they're terminal anyhow. But we need to evaluate them to see if the injuries contributed to their death. And so those are scenarios where we will do postmortem imaging to see if they had any injuries, but not do an autopsy unless something else came up. So that sort of is a group of cases that seem to be growing. But regardless, we're happy to have cases reported to us. In one way or another, we touched 94% of the deaths that occurred in the county. So quite a few came through our office from a variety of different ways. So on the next page, just as a reminder of what's on the death certificate. The cause of death is the underlying reason why they died. Manner of death is the circumstances. There's 5 categories: natural, accident, suicide, homicide, and undetermined. And then there's a lot of other information on there that's not on the death certificate that the families receive, but it's public health information that's gathered. And so this then flows up to the state and then ultimately to the CDC. So when you see these high-level numbers of this is how many motor vehicle fatalities, how many drug overdose deaths, and so forth, it really starts at the grassroots level and works its way up through the system. Who uses it? Obviously the family, and as I mentioned, the public health, and obviously sometimes funding and other things can be driven by this information. Okay, so getting into the data here, this is the manner of death. And so as you can see, the vast majority are on the right in the natural category. We had 1 undetermined, we had 40 accidents, 14 suicides, and 1 homicide. And as we go through this, the ones that have the color coded, so they're bright colors, those bar graphs are when the death occurred in the county. We're going to see some others that are dark blue, and that's when the injury occurred in the county, but the death may have occurred elsewhere. So it's just to sort of clarify, we're capturing if the injuries occurred and if the death occurred. So we're trying to get all of that information, but we'll go through that in more detail. So on the next page is deaths by unnatural causes. So we've taken out the natural deaths, and now we just have the non-natural. And so we have one blunt trauma, we have a burn, which was a motor vehicle accident, we have a cluster of drownings, but 3 of those were at one scene, so it's really 2 events that occurred. Firearms, which we'll go through in more detail, and then the jump fall category. And so we have more details on these, but 1 was from a ladder and 2 were downstairs, but most of these were fall from standing height or seated height. And then we have the poisoning or drug overdoses as well, which we'll go into. And then obviously motor vehicle accidents and ligature hangings. And so we'll go into each of those in more detail. So by manner of death, this is the suicide by means, and so we had 10 that were firearms. We had 3 ligature hangings, but 1 was transferred. The injury occurred in Wisconsin, and the person was transferred into Goodhue County and died here. And we had 1 intentional drug overdose death. So I will point out that this year the number of suicides did increase significant from previous years in the county. So just as, and I'll just note, if you want to do a deeper dive into this later, we're happy to work with your public health, and we can look at these cases and see if there's anything that's of value there. So if that's something you're interested in, just let us know, and we'd be happy to work with you on that.
That's probably the most alarming one to me, is that they felt there was no other choice but that.
Yeah.
That's very unfortunate.
Yeah, so yeah, we'd be happy to work with public health, and we can look into it and see if there's prevention and other sorts of information that might be of use. On the next is suicide by age, and there's none in the very young category, and they're kind of spread across the older age groups. So there's not particularly a cluster other than the largest numbers in that 45 to 64-year-old category. The next one is the suicide rate per capita. And so this is if the injury occurred in the county. And so this is per 100,000. So these are relatively small numbers. So that can move quite a bit. But you'll see that where Goodhue is across the, compared to the state average, which is the red line. On the next is homicide by county. And so there were, there's 1 blunt trauma in homicide last year. The next is the homicide rate per capita, and so there's 2 here, and that's because 1, the injury occurred in the county, but they were transported and died outside. So 1 was the injury occurred and they died in the county. Another 1 was injured in the county and then transported and died. So that's why you see 2 homicides on that page. Again, these are low numbers, so it can really move those bar graphs quite a bit. The next slide is accidental deaths by type. And so what obviously stands out is the fall category. As I mentioned before, the vast majority of these are older individuals that are falling from either sitting or standing. And so it's not sort of, falling down. We do have a fall down the stairs, and we have the ladder, but it's not that kind of category. It's other people with other underlying conditions where that pushes them over the edge. We have motor vehicle accidents, which we'll get into more detail, as well as the poisoning and drug category. So on the next slide, we have accidental deaths by vehicle crashes. And so, so just as a side note, which is kind of an interesting thing to note, is depending on the nature of the county and what the county has going on, really determines what sort of motor vehicle accidents. We have one county where they only have basically motor vehicle and pedestrians. In Goodhue County, we have the whole range of activities that are going on that you'll see reflected in this. And so I'll go into more detail, but we had 2 automobiles. So one was a car versus a tractor. We had one which was, so the other category is an ATV and a snowmobile. And so just to sort of, if we go to the next page, we have a map that really shows the different type of vehicle and where they occurred. And so again, this is, we have everything from snowmobiles, we have electric scooters, mobility scooters. So there's really just a whole range of motorized vehicles that are involved sort of as a spread across lots of different venues. And if we go to the next page, and this is this is the year, and so you can sort of get a sense of, year over year if there's, like cluster. The size of the dot reflects the number of the fatalities, and so, ones that sort of stand out here is we had a passenger in a vehicle, which was an infant. We had an electric scooter. Someone was on the road and was struck by a motor vehicle, and they were transported. Someone rear-ended a tractor, an ATV, and a snowmobile. So just lots of different vehicles and lots of different venues. And so, and I bring that up because it's not sort of like these are all like highway-related deaths. We've had these discussions before, like this regarding the zero death policy, but these are really just kind of a potpourri of different types of vehicles that are being used. On the next is the motor vehicle fatality rate per capita. So you can see where Goodhue County stands across the other counties in the southeast, and the red line is Minnesota. But again, these are very small numbers, so 1 or 2 deaths can really move that significantly. On the next slide is accidental falls by age group, and this just gives you a sense of what I discussed before about the increasing aging of the population and how the older population that has other conditions that are at risk. I mean, if you fall and break your hip, depending on what report, you might have as much as a 50% mortality in the next year to 2 years. So just to give you a sense of how hard that is on the body and the consequences for it. But that's what we're seeing is it's that aging population. And then on the next slide is accidental injuries by the location. So we're just trying to track where the injuries occurred. So let's see if we can go to the next slide. Oh, there it is, sorry. So this is the residence. So the majority of them that occurred in someone's home, and 2 in a care facility, 8 in an assisted living facility. Of course, medical centers are particularly concerned about falls, and this is a big public health issue that people are keeping tabs on. So this is why we're trying to get a sense of where are these occurring, with potential intervention in place. But they're very difficult to manage, to say the least. Next is slide is deaths related to poisoning or drugs, and so there were 7 illegal drug overdoses and 1 prescription medication overdose, and that was the suicide. So the prescription medication was an intentional overdose. So if you'll notice here, there's a significant drop from when it went up a couple years ago, so it's closer to where it was sort of pre-pandemic. On the next slide is accidental drug deaths by age group, and so we have 1 in 11 to 17, 1 18-25, 26 to 44, and 45 to 64 is sort of that peak. And that's in other counties. It's really that 45 to 64 is where we're seeing that like the majority of our accidental drug overdoses, which may be somewhat surprising, but some of these are, as we've gone and looked at them, a lot of times they're sort of chronic drug users, and the fentanyl is really kind of what's the wild card mixed in there. On the next slide is the drug overdose rate per capita, and so this is how many of these did the injuries occur in the county, and so there were 10 in which the injury occurred in the county, and 10 total deaths. On the next slide is the illicit drugs by categories. And so methamphetamine is still out there. We had 2 methamphetamine deaths. We had 2 that were just fentanyl, 1 fentanyl mixed with heroin, and 4 fentanyl and methamphetamine. So we seem to see that mix because fentanyl and methamphetamine seem to be the predominant drugs that we're seeing. And so there's a total of 9, but definitely a big drop from 2 years ago, thankfully. Next slide is deaths by natural causes. So heart disease and cancer are the leading causes of death here, but also the leading causes of death across the country. Neurologic deaths, we'll probably see those increase as the population ages. The leading risk factor for many of those is age. Pulmonary deaths are down a little bit, again, sort of stabilized from the peak in 2021. The liver deaths are up, and so 5 of those, 8, and then there was another one with alcohol related to a fall, were alcohol related liver disease deaths. And I point that out because there has been sort of as a lagging sort of indicator post-pandemic of increase in liver-related deaths related to chronic alcoholism. So that is something that we've seen trending upward. The next page is the deaths by age group. And so again, the further this is skewed to the older population, that's representing people dying of natural disease. When you have bumps in the lower categories, that's telling you that people are dying of accidents, suicides, and homicides because our young people are not dying from their natural disease. And so, again, the vast majority is up there, and we keep adding these age brackets. You know, it's been pointed out to us a couple times now, and it stands out here that 85 to 94 is definitely a dangerous period of time as people are aging up. And so, but yeah, it is what it is. So, and then the final slide is medical examiner activities, and this has been very stable year over year. We had 352 investigations. We signed 97 death certificates. We went to 92 scenes. We did 56 postmortem exams, and 411 deaths were reported to us. So again, pretty stable year over year. So kind of a whirlwind tour through a lot of information, but happy to answer any questions you might have.
Any questions for?
Just a comment. You know, back to the suicide, I do hope we can spend some time with staff and HHS and looking at that. And I'm convinced it'll come out to be a lot of mental health issues that are the driver there. But it certainly proves we can't let our guard down. We got to keep working on it, because that's not a good number, not in any stretch.
Now, we're happy to work with you all, and we can pull that information on a case-by-case basis and see what, you know, are there themes there, or there's other information that would be helpful.
Anything else?
Well, are you able to comment if that number is a statistically significant increase, or if it's likely, because the numbers vary from year to year?
Yeah, I don't know if it's a statistically significant increase.
It may or may not be.
Yeah,
Yeah.
I mean, it could just be a one-year bump. You know,
Yeah, I understand that, and it'll take some time, but the statistical analysis isn't telling you that. Is that correct? Thank you.
And I agree with you, except I'll say in that 45 to 64 group, it's like
Yeah.
Yeah.
that.
Yeah.
You know, I would have, going into this, not knowing anything, I would have thought it would be younger.
Yeah.
And that surprises me.
Actually, the older you are, the more likely you are to die of suicide. Younger people attempt suicide more often, but older people are more serious about it when they make an attempt and are more apt to be successful.
Yeah, and hopefully there's a point of intervention in there that can.
Yeah, absolutely.
Anything else? Well, we really want to thank you for taking time out of your day and coming in, and sorry for the delay. We
That's okay, I understand.
go and
Thank you.
thank you very much.
Thanks.
And it just proves once again that when I fall in the winter, I need to be more careful of fall
Boy.
some other way that won't hurt me.
Well, you know, that's like the joke, you know, you've gotten older, because like when you're young and you fall, it's funny. When you're older, it's like a serious event, right?
Yeah.
It's like a